Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
If you've ever caught yourself wondering, do I have OCD? Or heard someone say, I'm so OCD when things feel messy or out of place, you're not alone. OCD is one of the most commonly misunderstood mental health conditions, and those casual phrases don't really capture what it actually feels like to live with it. Obsessive-compulsive disorder is not about being neat, organized, or particular. It's a condition that can take over a person's thoughts, consume hours of their day, and create a level of distress that's hard to explain unless you've experienced it. In this episode, we're going to break it down clearly. What OCD really is, what causes it, how to recognize the symptoms, and most importantly, what effective treatment actually looks like. What OCD is. OCD stands for obsessive-compulsive disorder, and it has two core components that work together in a loop. The first is obsessions. These are unwanted, intrusive thoughts, images, or urges that show up in the mind and create anxiety or distress. They're not something a person chooses, and they're often completely out of line with how the person actually thinks or feels. The second is compulsions. These are repetitive behaviors or mental rituals that someone performs to try to reduce the anxiety caused by those obsessions. The relief is usually temporary, which is why the cycle keeps repeating. According to the National Institute of Mental Health, about 1 in 100 adults in the United States are affected by OCD each year, which makes it more common than people often realize. Common symptoms. OCD can look very different from one person to another, but the symptoms tend to fall into recognizable patterns. On the obsession side, people might experience fears of contamination or germs, intrusive thoughts about harming themselves or others, or disturbing thoughts that feel completely out of character, including violent, sexual, or religious themes. Some people also feel a strong need for symmetry, or things being just right, and when that feeling is off, it creates real discomfort. On the compulsion side, the behaviors are usually attempts to neutralize that anxiety. That might look like excessive cleaning or hand washing, repeatedly checking things like locks or appliances, counting or repeating words silently, or arranging objects in very specific ways. The key difference between OCD and everyday habits is impact. These thoughts and behaviors take up time, create distress, and interfere with daily life, relationships, and work. Types of OCD. Clinicians often group OCD into subtypes, not because the diagnosis changes, but because it helps guide treatment. Some people experience contamination OCD, where the fear of germs or illness drives excessive cleaning. Others deal with checking OCD, where there's a persistent fear that something bad will happen if they don't check things repeatedly. There's also symmetry or ordering OCD, where things need to feel balanced or exact, and intrusive thoughts OCD, where distressing thoughts show up that don't match the person's values. Many people experience a mix of these patterns, and that overlap is completely normal. What causes OCD? The exact cause of OCD isn't fully understood, but research points to a combination of biological and environmental factors. Brain imaging studies have shown differences in the circuits involved in decision-making and habit formation. Genetics also play a role. as having a close family member with OCD increases the likelihood of developing it. Environmental factors, such as stress or trauma, can trigger or worsen symptoms, and neurochemistry, particularly serotonin regulation, is also involved. One of the most important things to understand is that OCD is not a personality flaw. It's not caused by being overly controlling or anxious. It's a medical condition that involves how the brain processes thoughts and responses. Is OCD curable? OCD isn't considered curable in the traditional sense, but it is highly treatable. With the right approach, many people significantly reduce their symptoms and regain control over their lives. How OCD is diagnosed? There isn't a lab test for OCD. Diagnosis is made by a mental health professional through a detailed conversation about symptoms, how much time they take up, and how they affect daily functioning. Clinicians often use structured tools like the Yale-Brown Obsessive-Compulsive Scale to measure severity. A key threshold is whether symptoms take up more than an hour per day or significantly interfere with life. When that level of impact is present, it's a strong signal that professional support can help. Treatment options. Treatment for OCD is well established and highly effective when done correctly. The gold standard is a form of cognitive behavioral therapy called exposure and response prevention, or ERP. This approach gradually exposes a person to the thoughts or situations that trigger anxiety while helping them resist the urge to perform compulsions. Over time, this retrains the brain and reduces the intensity of the cycle. Medication can also play an important role, especially for more severe cases. Certain antidepressants, particularly SSRIs, are FDA approved for OCD and are often used at higher doses than those prescribed for depression. For people who don't respond to standard approaches, there are advanced options. TMS has shown promise in treating OCD, and in rare, severe cases, treatments like deep brain stimulation may be considered. Often, the most effective approach is a combination of therapy and medication. Daily strategies. While professional treatment is essential, there are also ways to support progress day to day. Practicing mindfulness can help reduce reactivity to intrusive thoughts. Keeping a structured routine can limit overwhelm and decision fatigue. Support groups provide a sense of shared experience and practical coping strategies. And regular physical activity has been consistently linked to improved mental health. These strategies don't replace treatment, but they can reinforce it. Living with OCD can feel exhausting and isolating, especially when the thoughts don't make sense even to you. But it's important to remember that effective treatment exists and improvement is absolutely possible. At Zeam Health and Wellness, we provide evidence-based care for OCD, including cognitive behavioral therapy, exposure and response prevention, and medication management when needed. Our goal is to create a supportive, judgment-free environment where you can understand what's happening and start making real progress. If you've been wondering whether what you're experiencing could be OCD or you're ready to explore treatment options, reaching out is a strong first step. And in next week's episode, we're going to take a closer look at another condition that's often misunderstood: what bipolar disorder actually looks like day to day. We'll talk about how it presents, how it's different from depression, and what effective treatment really involves.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.